Blog Talk Radio.
Good morning. This is Dr. Mark Snow with the Head, Neck, and Back Pain Relief Center of West Valley, chiropractic physician and author of the book Sick World, The Story of Modern-Day Slavery. Welcome to the program this morning. I want to remind everybody our call-in number, if you have questions or comments, 646-716-5217. That's 646-716-5217. If you do want to email me questions, I'd be happy to respond to those. The email address is drsnow@utahpainreliefcenter.com. That's DRSNOW @utahpainreliefcenter.com. We have a number of items we're going to be discussing this morning that deal with health issues, nutrition, diet, weight loss, exercise, and musculoskeletal health. Before we get into that, let's go ahead and listen to a word from our sponsor. And we're back. So this first study, which comes out of the Journal of Exercise Physiology.
Auto accident? Contact the Utah Whiplash Group, certified specialist physicians, attorneys, and massage therapists. UtahWhiplash.com.
Well, I'm sorry for the technical problems there. Anyway, this study comes out of Journal of Exercise Physiology, January 2014. A new study has discovered that exercise can increase the physiological stress response in obese individuals and thereby make it more difficult for them to lose weight. The finding may explain the difficulties that many people encounter while trying to lose weight despite exercising consistently. Lead author Dr. Bernjar Foss adds, "It's often said obese people should change their diet and exercise to lose weight, but they may also need to deal with stress." And this is something we talked about last week, and stress and the effects it has on our lives and our bodies. Again, let me reiterate, stress is not just something that goes on in our head. Stress is creates physiological change in our bodies. And so we need to deal with that stress. Now, Dr. Hans Selye really was the person who studied stress and coined the word stress and its effects on the body, talked about how it affects us, did a lot of research in that. And he talked about a threshold. You know, everything that goes on in our lives creates stress. Even having a wedding. I remember my daughter's weddings. What a stressful situation that was. So even those types of things cause stress. Good things cause stress. But according to Dr. Hans Selye, we reach a threshold where this stress accumulates in our body. The effects of the stress accumulates in our body, and we reach a threshold where we start to have symptoms. The idea here is to keep that stress effects below that threshold. Now, health has a triad. There's a triad to health. There's chemical, there's physical, and there's emotional. And things we do in our lives affect every leg of that triangle, every side of that triangle. If we are eating unhealthy, that's going to affect the chemical side. If we are taking too many medications, that'll affect the chemical side. If we drink alcohol, that'll affect the chemical side. If we're taking stimulants and coffee and things like that too much, that'll affect the chemical side. Emotional side, if we lose a job, we lose a spouse, we're going through a divorce, we're having children that are having problems, or like I said, we have a wedding we're planning, these things will affect the emotional side. And then the physical or the structural side, that deals with musculoskeletal situations. Problems in our spine, problems in our joints, those things will affect that side of the triangle. So if we take steps to mitigate effects on all of those different sides of that triangle, we can reduce, or we can actually raise our threshold level for stress so that we don't get symptoms from the stress. Again, call-in number is 646-716-5217. That's 646-716-5217. If you have any questions or comments, feel free to call in and share that with us. This next study out of Journal of Chiropractic Medicine, December 2013. In this case study, a 15-year-old male with migraine headaches received chiropractic care consisting of full spine adjustments and exercises over 19 weeks. In addition to complete resolution of his headache symptoms, this patient also noted positive effects on the boy's other disorders, including attention deficit hyperactivity disorder, obsessive compulsive disorder, and Tourette syndrome. They observed fewer Tourette tics, a 90% increase in his ability to be attentive, and an improved ability to stay awake while studying. So this is something that's important to talk about too, because often chiropractors are thought of as just back doctors, back pain, neck pain, and it's true. Chiropractors treat people with those conditions and and effectively help people relieve those symptoms. But what people don't understand, and the point I want to make is that while treating the spine, the spinal column, the vertebrae of the spine, we are affecting the nervous system, because the central nervous system, the spinal cord, which is part of the central nervous system, is housed in that spinal column. The nerves that exit off of that spinal comes out between the vertebrae, between those vertebrae in the spinal column, to go to all the different organs and tissues of the body. So while we are treating those vertebrae and those joints in the spine, we're affecting the nervous system, which thereby affects all of the different systems of the body. It's not uncommon for individuals to go to a chiropractor with back pain or neck pain or headaches or whatever pain situation they're going to the chiropractor for, receive treatment for that, and have other conditions that they didn't make the chiropractor aware of clear up. One such case, I had a patient who came to me for back pain, low back pain. And she did tell me during her intake interview that she was having kidney problems, and in fact was scheduled to start dialysis because her kidneys were not functioning very well. Well, we started her on a regimen of treatments for her low back pain. She informed me after about 6 weeks of care that her urologist told her her kidneys are now functioning 90%, and she didn't have to start dialysis. I didn't treat her kidney problem. I was treating her for low back pain. But by treating the spinal column, we affected the nervous system, which then affected her kidneys. Again, the call-in number 646-716-5217. This is Dr. Mark Snow with the Head, Neck, and Back Pain Relief Center of West Valley in West Valley City, Utah. Chiropractic physician and author of the book Sick World, A Story of Modern-Day Slavery. My book is available on Amazon, Barnes & Noble, and exlibris.com. I also have a book signing coming up on the 19th of this month. It's Thursday, June 19th. And that'll be held at Weller Bookworks in Trolley Square in Salt Lake City, Utah. So if you're in the Salt Lake City area, come on by. That's at 6 p.m. on Thursday the 19th. And check out my book. I'll be doing a reading from it and then signing copies for individuals. I'd love to have you there. So here's a study out of Cancer Magazine, May 2014. Current guidelines recommend that women over 65 years of age who had previously had regular cervical cancer screenings no longer need to be screened. However, a new analysis of the available data shows that women over the age of 65 are at the highest risk for cervical cancer, which has researchers calling for the American Cancer Society and American Society of Clinical Pathology to update their guidelines and reflect this finding. Moving on to our next study, this is out of the American Journal of Sports Medicine. New research has discovered that the rate of concussions among American high school athletes has doubled between 2005 and 2012, but the rise is most likely related to increased awareness and legislation governing concussions. So lead researchers Dr. Joseph Rosenthal explains, the bottom line is that rates have gone up. We don't know the exact reason. This was an observational study, so I can't say for sure, but I believe what is explaining the increase is the increased awareness, not that sports are more dangerous. It's just that the concussions are being recognized more, which is good news. End of quote. So what's important also when we're talking about concussions, especially in children, is those injuries have long-term effects. We can't suppose that if somebody has a concussion and they rest for a while and don't do anything to fix that problem, then it's not going to affect them, because it will. When you suffer a concussion, a closed head injury, there's changes that occur in the brain, and those have to be addressed. There have been studies after studies that have been done with neurofeedback therapy that show that it has a 99% effective rate at identifying the effects of concussion. And that's with a quantitative electroencephalogram. Then designing a protocol based on that using neurofeedback, that can be corrected, which is something that should be done. In fact, the NFL now has quite a program for their players who suffer concussions to get a functional MRI, which is another effective way of identifying changes in the brain function because of concussion. And then they have a training program that they go through, which is a more physical in nature, to help correct those dysfunctions in the brain. So this is something that's just on the forefront of understanding how the brain is affected by concussions and fixing that. And for years we thought just, rest for a few days and then you're back in the game. But that is not the case. It needs to be addressed. The changes that occur in the brain, the dysfunctions that occur because of concussions need to be addressed. The percentage of Americans taking, this is out of Centers for Disease Control and Prevention, May 2014. The percentage of Americans taking prescription drugs has increased dramatically in recent years. From 2007 to 2010, about 48% of people reported they are taking a prescription medication, and increased from 39% between 1988 and 1994. 48% of people are taking a prescription medication. That's staggering. Half of the people walking around have to have a prescription medication. My book, Sick World, The Story of Modern-Day Slavery, talks about this. Understand, this is a novel. It's a fictional story. It's not data. It's very enjoyable to read. Sick World, The Story of Modern-Day Slavery, available on Barnes & Noble, available also on Amazon, available on xlibris.com, and in local bookstores. Book signing at Weller Bookstore or Weller Book Works in Trolley Square, Salt Lake City, Utah on June 19th at 6 p.m. So our quote for today comes from George R.R. Martin. A reader lives 1,000 lives before he dies. The man who never reads lives only once. Thank you for joining me today. Have a wonderful day, and remember our fallen heroes at D-Day, 70 years ago today. Goodbye.